Hey, so I plan on heading out this evening. So I pumped a full bottle. There's also milk in the freezer already, but I always like to leave dad and baby with a freshly pumped bottle of milk just because sometimes baby's funny that way. And we prefer a freshly pumped bag of milk. But today, before I go, I just wanted to touch on low milk supply. So if you're experiencing a low milk supply, a couple of remedies for that are to nurse frequently, 10 to 15 minutes on each breast, 8 times a day. And that's 2 to 3 hours. So not like literally every 10 to 15 minutes, but every 2 to 3 hours, nursing 10 to 15 minutes on each side. And that will reduce lopsidedness as well. And then drinking lots of fluids. You can grab a glass of water, juice, milk, tea while you're feeding. That can help sometimes. Herbal teas are good. You want to avoid too much caffeine or cola. And then hot compresses and hand expressions can help initiate your letdown. And then also when you begin to supplement with formula, that means you're beginning to nurse less often, which equals low milk supply. So that's what we want to try to avoid. It's suggested to do at least 6 months of breastfeeding, and encouraged to do at least a year of breastfeeding. Now for me, my first kid, I did 23 months of breastfeeding. Second kid, I did about 2.5 years, and we'll see how the third kiddo goes. Now that was totally up to baby. It was extremely difficult for me to wean, and that's a whole nother video in itself. Weaning can be very difficult, especially when you go for the longer amounts of time. And not to scare anyone away from breastfeeding, but weaning, I mean, they got the best stuff. Breast is best. So, I mean, of course they don't want to let go of it. But there comes a time when mom may be ready to like, hey, I'm done with this. But again, that's another video. But today our focus is low milk supply. And then nurse frequently. When you're not nursing, you want to pump. So like usually when you're around baby, you're going to be nursing like 2 to 3 hours depending on the baby's age. But most of the times when it's a newer baby, it's going to be 2 to 3 hours. If you are working or plan on returning to work, there's going to be longer periods of time when you're not nursing. You want to make sure that you're pumping. You want to make sure that you're pumping while you're not feeding or while you're away from baby. That will help keep your supply up. You don't want to get in the habit of going a long period of time without feeding or pumping, because that can lead to low milk supply. And if some of the natural things aren't working, like drinking lots of fluid, nursing frequently, pumping frequently, then you might want to try a couple of alternatives. Now, these are just a few. We can talk about some more later, but milk makers, lactation cookies, seem to work for me in the past. I haven't tried them again this time because this baby eats quite a bit. So I'm pretty sure that my body's producing quite a bit of milk. So it's never really a big deal for me to produce a full 5-ounce bottle in 10 to 15 minutes. That's not a problem. But again, milk makers, lactation cookies, they seem to work pretty good. Try them out. They can be a little bit pricey, but anything that's gonna help your milk supply go up, especially when you have a baby that's completely dependent on breast milk and you tried formula and they don't want the formula, try these. A second alternative is fenugreek pills. You can get them at any type of supplement store, maybe like Super Supplements. I'm pretty sure you can get them on Amazon, possibly Walmart, Target. I'm not too sure about the Walmart or Targets, but definitely naturopathic stores. Fenugreek is a good one as well. Now, these pills don't smell so great, and they may not even taste great if you're super sensitive like me. I'm super sensitive to things like this, but these are good things. So again, fenugreek, and then Milk Makers cookies. Try those for low milk supply. And then if you have any questions, I'm definitely I can definitely answer any questions. So just leave any questions in your comments, and I will answer them for you. I'm a very experienced breastfeeding mother. I've been doing this for over a course of 7 years, off and on, of course. But yes, hopefully this video is a little helpful, and if it's not, let me know what I can do to make it helpful for you. Toodaloo!